Good afternoon. I'm Mandy Cohen. I'm Secretary of the Department of Health and Human Services. And today we have a number of special guests with us. I'll be joined by Dr. Cardra Burns, our Senior Deputy Director at the Division of Public Health. Dr. Burns is leading our testing effort. And Dr. Viviana Martinez-Bianchi with the Duke Department of Family Medicine and Community Health, and a member of our Historically Marginalized Population COVID-19 Response Work Group. Also with us today is J.B. Buxton, a member of our State Board of Education. We are also joined, as always, by Nicole Fox and Karen Magoon, who are our American Sign Language interpreters, and Jackie and Jasmine Matevier are our Spanish translators. I'll start with a rundown of our numbers as of this morning. There were 93,426 laboratory confirmed cases, 1,134 people who are currently hospitalized, and sadly, there have been 1,588 deaths. So today is a data day. I know you've all been waiting all week for your favorite graphs and charts. And as I said on Tuesday, we have continued to simmer, but have so far avoided boiling over, as a number of states are now doing. As I go through the data, don't forget, we have the ability to impact these trends right now, today. What happens next largely depends on how each North Carolinian answers three simple questions. Will you wear a face covering? Are you waiting 6 feet apart? And are you washing your hands frequently? I hope you know the answer should be yes to all those. All right, let's get started. As a reminder, we use a combination of metrics. We look at COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. Some of these metrics help us understand the rate of viral transmission in the past few days, while other metrics like hospitalizations tell us how much transmission was happening a few weeks ago. Let's dive in. Our first graph looks at people who come to the emergency department with COVID-like symptoms. This is the most timely data we have, and it's our earliest detection mechanism. Taking a look at this trend, you can see that yellow line continues to increase. This metric is not impacted by our testing rates or other factors. Again, it's an early warning indicator, and it's indicating that it continues to go up, which is concerning. Next, we look at laboratory confirmed tests. This is another of our more timely key metrics. This slide gives you a look at the trajectory since we've had our first case back in March. But it's helpful on this next slide to zoom in and get a better sense of our current picture. As you can see, looking at that yellow line, the number of new lab-confirmed tests of COVID-19 is still increasing. Today, we have another high number of new cases at 2,160. We want to see this curve flatten and then keep it flat and trending downward, but we aren't there yet. Now we're looking at the percent of tests that are positive. Looking at that very flat yellow line, you can see that the percentage of total tests that are returning positive has been holding steady at between 8 and 10%. Now it's a good sign that this trend has continued to hold steady, but we would like to see this number closer to 5%. It remains elevated. And the next metric is our day-over-day hospitalizations. And I draw your attention again to that yellow line. Hospitalizations continue to rise. And as I've mentioned before, people who are going into the hospital today were likely infected days or weeks ago. That's why we call this a lagging indicator. With daily case counts continuing to go up, we know we will continue to see an increase in this metric in the weeks ahead. That's why we're in constant communication with our hospitals across the state. Fortunately, we still have hospital capacity here in North Carolina. All right, in summary, here's where we are today. Our surveillance data shows a continued increase. This gets a red X. Our North Carolina's trajectory of lab-confirmed cases continues to increase. It also gets a red X. North Carolina's trajectory in percent of tests returning positive remains level, but it's still too high. It gets a yellow line. And as I said, I'd like this to be cut in half, closer to about 5%. North Carolina's trajectory of hospitalizations is also increasing, but we have capacity, again, a yellow line. We're also tracking our critical capabilities, the ability for us to respond to this pandemic. Testing, as you can see, has that sideways arrow. For the past week, we've averaged about 25,000 tests a day, which is a huge amount of testing, and that's very good news. But you have repeatedly heard me raise concerns about testing turnaround times, supply chain issues, and the need for federal support. More and more states are raising the alarm about these challenges. In North Carolina, we're working night and day to increase testing and improve access across the state. And you're going to hear more about that in a moment from Dr. Carter-Burns on those efforts. But we need our federal partners to help our states and suppliers get on the same page so that people can have timely test results and use that information to protect themselves and their communities. On contact tracing, things continue to go well. We're continuing to hire tracers to bolster our efforts in our local health departments and meet their ongoing needs. These community team members reflect the diversity of the communities they serve, and almost half are bilingual. Again, our PPE supplies continue to be stable. So today we're going to hear updates about two critical areas of our work: expanding access to testing and getting health information out to our Latinx Hispanic communities. First, we're going to hear from Dr. Carter-Burns, and she'll share an update on our initiative to provide free community testing events across the state. These events ensure that those that are being hardest hit by this pandemic, Latinx Hispanic communities and our African American communities in North Carolina, that they have access to testing. All right.
Thank you, and thank you, Secretary Cohen. As Secretary Cohen just said, I am here to share an update on our work to expand access to testing, which is my team's top priority. We are focused on breaking down barriers to testing to make sure every North Carolinian can access a COVID-19 test if they need one, particularly those who have been hit hardest by this pandemic, our historically marginalized populations. As the Secretary announced earlier in July, throughout this month, we are sponsoring cost-free community testing events across the state. These sites are strategically located in zip codes we know didn't have easy access to testing before, and for those populations that have been disproportionately impacted by COVID. People who are African American, Latinx Hispanic, American Indian, elderly with multiple chronic conditions, or those who work in essential settings like our construction and seasonal farm workers. So far, the community response to these testing events have been overwhelming, both in terms of the number of people coming to these sites to get tested and the support we're hearing from the community. That early feedback tells us the need for this initiative is very much there and suggests we are getting these resources out to the places that need them. So far, in just under 1 week, there has been 60 testing events with almost 2,000 tests collected. We plan to double that in the next 2 weeks. But importantly, these events are being held in places trusted by and accessible to our historically marginalized populations. When we talk with our communities about barriers around testing, it's clear we have to put an emphasis on breaking down cost barriers to make sure no one skips a needed test because of financial concerns. All of the community testing events that are a part of our initiative are free, and I will say that again, free. We have also added an important new feature to the Find My Testing Place digital resource that helps people to find a testing place near them. Now you can enter a zip code to get information about testing sites in your area. That information will include whether or not there is a cost for testing at that location. As I mentioned, all of our state initiative testing sites are free of charge, but we know there are other sites and costs can vary. You can now use our Check My Symptoms in either English or Spanish to help you determine if a test is recommended. Thank you.
Terrific. Thank you, Dr. Burns. Today, we are launching a Spanish language companion to our Check My Symptoms online tool to help North Carolinians determine if they need to be tested for COVID-19 and to help people who have tested positive or have been exposed to COVID-19, making sure they're able to monitor their symptoms. As we talked about before, I have been deeply concerned about the health of our Latinx and Hispanic community, and this new tool is one way in which we can help our Spanish-speaking community members protect themselves and their families. I'm pleased that we have with us Dr. Viviana Martinez-Bianchi to discuss how we can continue to protect ourselves and our families from this virus. Dr. Bianchi.
Thank you, Dr. Cohen and Dr. Burns. The best way to prevent COVID-19 illness is to avoid being exposed to this virus. The best way to prevent spread in the community is to stop the spread of the virus. The faster we get COVID under control, the faster life will start to get back to normal. We all play a really important role in protecting our coworkers, friends, families, and others by wearing face coverings and keeping a safe distance from each other. Wear face coverings in public settings and when around people outside of your household, especially when other social distancing measures are difficult to maintain. Face covers are not a political statement. The virus doesn't care which political interest you have. It is not a debate question or a fashion statement. Wearing a face covering is a solution to slowing COVID from spreading. Face coverings help prevent people who have COVID-19 from spreading the virus to others. And since many people who carry the virus do not know it, wearing the mask helps to stop that spread. Always wear a face covering in public. It has to cover your mouth and your nose to protect from COVID. Practice Safe 6. Put distance between yourself and other people, at least 6 feet apart. Clean your hands often, either with soap and water for 20 seconds or a hand sanitizer that contains at least 60% alcohol. Avoid close contact with people who are sick. And if you have to take care of them, put on your mask and gloves and use all the necessary hygiene measures to avoid contagion. Clean and disinfect frequently touched objects and surfaces daily. In addition, we are launching the Check My Symptoms tool. This web-based tool that you can find in the North Carolina DHHS website helps you check your symptoms online and determine if you will be recommended to be tested for COVID-19. After you enter your symptoms, if it is recommended that you get tested, you will receive a list of nearby testing sites via email or text, whichever your preference. Wear that face covering, wash your hands, wait apart from others. And now I will say this in Spanish. La mejor manera de prevenir la enfermedad de COVID-19 es evitar exponerse a este virus. La mejor manera de prevenir la propagación en la comunidad es detener la propagación del virus. Cuanto más rápido tengamos COVID bajo control, más rápido comenzará la vida a volver a la normalidad. Todos jugamos un papel muy importante en la protección de nuestros compañeros de trabajo, amigos, familias y otros, al usar cubiertas para la cara y mantener una distancia segura el uno del otro. Use protectores para la cara o mascarilla en lugares públicos y cuando esté cerca de personas fuera de su hogar, especialmente cuando otras medidas de distanciamiento social son difíciles de mantener. Por ejemplo, cuando va en su auto de camino al trabajo con compañeros de trabajo. Las mascarillas o protectores faciales no son una declaración política. Al virus no le importa si usted es de un partido o del otro. No es una pregunta de debate ni tampoco una declaración de moda. Usar una cubierta facial es una solución para reducir la propagación de COVID. Las cubiertas faciales ayudan a evitar que las personas que tienen COVID-19 transmitan el virus a otras personas. Y dado que muchas personas que portan el virus no lo saben, usar la máscara ayuda a detener la propagación. Siempre use un cobertor facial en público, cuando va a la tienda, cuando va al supermercado. Tiene que cubrirse la boca y la nariz para protegerse de COVID-19. Espere a 6 pies de distancia de otras personas. Lávese las manos con frecuencia, ya sea con agua y jabón durante 20 segundos o con un desinfectante para manos que contenga al menos 60% de alcohol. Evite el contacto cercano con personas que están enfermas y si tiene que cuidarlas, póngase su mascarilla y guantes y utilice todas las medidas de higiene necesarias para evitar contagiarse. Limpia y desinfecte objetos y superficies frecuentemente tocados de manera diaria. Además, estamos lanzando la herramienta Comprobar mis síntomas. Esta herramienta se encuentra en la web del Departamento de Salud de Carolina del Norte y lo ayuda a verificar sus síntomas en línea y determinar si se le recomendará hacerse la prueba de COVID-19. Después de ingresar sus síntomas y sus datos, si se recomienda que se haga la prueba, recibirá una lista de sitios de prueba cercanos por correo electrónico o mensaje de texto en su teléfono, dependiendo de su preferencia. Use la cubierta facial, lávese las manos y espere aparte de los demás. Muchas gracias.
Well, thank you, Dr. Martinez Bianchi. It's wonderful to be joined by such amazing women leaders that we have in our state. As we talk through this data and these new resources today, I know that families across the state are thinking about this week's announcement about school reopening. This is a stressful time where there are no perfect decisions. That's why I want to reassure North Carolina students and parents and teachers that I'll continue to be open and accessible through these briefings. We will continue to provide transparent and comprehensive public resources that you can check on our website to find specific guidance and materials that we'll have around schools and what's going on with the virus across our state. Finally, I want to emphasize that as our communities work hard to get our children back to school, everyone in North Carolina has an important role to play by practicing, again, the 3 W's: wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. Wear, wait, and wash. And with that, we will open for your questions, and I'll remind you that we are also joined by J.B. Buxton from the Board of Education to answer a whole range of questions on schools and other topics that you may have. Thanks.
We'll take our first question today from Claire Donnelly with WFAE Radio in Charlotte.
Hi, it's Claire Donnelly with WFAE Radio in Charlotte. I know that statewide we're seeing the between 75 and 80% of hospital beds are in use. I'm wondering if you could tell me how this compares to what hospital capacity was, what normal hospital capacity was pre-COVID-19. Thanks.
Thanks, Claire. A question about hospital bed capacity and where does that lie? So as you may know, hospital bed capacity goes up and down with seasons and various things that are going on. And hospitals are able to control their capacity and do their staffing. So I would say it changes over the course of the year. But I think we're about at where we would normally see capacity, which is why we continue to say we have capacity within our state. The question is, do we have the capacities in the places where we need them? Right? Because we're looking at an overall picture from our state. We also need to look at that from a regional perspective as well. And I'll preview for you that we're going to be putting additional information about hospitals up on our website as early as tomorrow night, so stay tuned for that. But as we look at ensuring that we have hospital capacity, we really do look at a regional picture, try to draw in hospitals from that entire region to have a conversation about hospital capacity. We did just that. For example, I mentioned that a previous press briefing about that in Charlotte, that we brought the various hospitals in the Charlotte area together because we can make sure that they're helping each other out. And that's exactly what we're seeing. I'm really pleased with the coordination, the communication, the transparency that's going on, and it helps each other make sure that if one hospital is getting a little bit more full, how can we balance that out between hospitals? So again, we are trying on a daily, frankly, hourly basis to understand what's happening in our hospital system to make sure that we can respond and react and do different things if we need to. But the overall, news for today in terms of hospitalizations is they are slightly up, but we have capacity here in our state. Thanks, Claire.
Our next question is from Matt Mercer with the North State Journal.
Hey, good afternoon. Dr. Cohen, thanks for taking our question. One thing that we've gotten as we've talked to other organizations and folks kind of around the hospital system is that people that are in the hospital for unrelated surgeries or unrelated things, they get tested at the hospital, and then it turns out they become a COVID case that's confirmed there. Can you talk about what kind of prevalence that has in the numbers that are recorded? And secondly, are people counted as 2 confirmed cases if they test positive twice, or is it still that one person individually?
Great. Let me take your second question because that's an easy one. We make sure that one person, one test. So when we count our numbers, that even if you've had multiple tests, we only count you once and when we are counting the numbers. I keep hearing there's hospitalization related to unrelated surgeries. That prevalence is extremely low. And what I would say is I encourage folks, in the media in particular, to get in touch with some of our hospitals, particularly in the Charlotte area, who I know are seeing a lot of cases of COVID-19 and some folks who are quite sick, and I'd engage with them in a conversation about what they are seeing within their hospitals, because we are seeing a higher burden of COVID-19 patients in our hospitals. Now, we are not at a place where we're needing to go into surge capacity, as I was sharing with Claire, but again, this is not just incidental findings in our hospital. These are sick folks who are unfortunately coming into our hospital that are getting taken care of by some of our doctor, nurse, and other clinician heroes, and that we are working hard as a state to keep the spread of our virus low so we don't overwhelm our healthcare system. I think what you are seeing in other states, whether it's Florida or Texas or Arizona, is that hospitals are running out of capacity. There are many hospitals who are now on divert, which means they're not taking any new patients. We don't want to get into that situation where we cannot no longer access capacity in our healthcare system, because as I was mentioning when I went through the data, hospitalizations is what we call a lagging indicator, meaning it's telling you what was happening a few weeks ago. So if we only react to hospitalizations, we're going to be too late. We need to make sure we're watching all of our indicators to make sure that we don't overwhelm our hospital system. Thanks.
We have a follow-up from Matt Mercer at the North State Journal.
Hey, yes, thanks. So a quick follow-up on this in terms of the contact tracing that's been done. The website is updated once per week with the number of full and part-time contact tracers, but one thing that we also do not see is what is the goal for the number to have, or is that going to be kind of something that is ever-changing as the process goes on?
Matt, great question. And I think it's the latter. It's going to be a changing number. If we have more cases, we're going to need more contact tracers. I'm hoping that we are going to work hard as a state so that we are slowing that spread of the virus, and so we can stabilize these numbers. If we stabilize, then we won't need additional contact tracers. So we continue to surge up resources to meet the demands, and we're working very closely with our local health departments on that. But that we will continue to surge those resources if we need to. It's another reason why we all need to work to slow the spread of the virus. I want to make sure that we don't need more contact tracers, but we will hire more if we need them for our state, and we all have a part to play in slowing the spread of the virus. Thanks.
Our next question is from Daniel Viotto with Telemundo Charlotte.
Thank you. Based on information we received from reliable sources, immigrants seeking for health assistance because of COVID-19 are not accepted in hospitals because they do not have health insurance. We have received multiple and similar allegations in the last few months. Are you aware of this situation? What message the state has for thousands of immigrants in such a dramatic situation right now?
Daniel, I'm so glad you brought up this question because we want to make sure that we have accessible care for everyone who is here in North Carolina. As you know, our hospital systems are already by law required to treat anyone who walks through their doors. It's an EMTALA law. They cannot be asking about either insurance status or immigration status in order to treat someone who is right in front of them. So that should not be happening in any hospitals. So please do get in touch with our office if that is the case. Now, we do know that there are access issues for folks who do not have insurance. I think that's why Dr. Burns was talking today about free testing sites. We know that without insurance, that testing can be quite expensive for someone, but we want to make sure that those tests are accessible to folks, which is why we are putting those free sites up in zip codes that have been impacted by COVID-19, but also we see our historically marginalized communities. So we're trying to make testing accessible, but please do get in touch with us about any other concerns. I want to turn over to Dr. Martinez Bianchi for more about how we can make sure those in our Latinx and Hispanic communities get access to care.
Thank you, Dr. Cohen, and thank you for the question, Telemundo. We host a weekly, what we call Latin 19 from Durham, but we've been hearing this more and more, and we have identified it as an issue of self-advocacy in one way, but also the importance of really figuring out where are these cases happening and how can we inform our hospital organizations, our people working in triage to really not turn people back. We have heard stories of people who have even tested their pulse oximetry at home and realized that were dropped in the hospital, and if they didn't have a culturally appropriate interpreter, were overwhelmed by the questions and told that, well, they weren't sick enough to stay home when they were definitely sick enough. So we really are trying to understand the magnitude of this situation. I work with one of the task forces for the vulnerable and marginalized populations. I also work in different task forces, and I'm now working directly with Dr. Cohen. So it is extremely important that we talk together and understand where are these situations happening to prevent from happening. It's an issue of self-advocacy that shouldn't have to be so hard to do, that organizations should not put already struggling families, fearful of what is happening with their health, having to explain that they're really sick enough to be in the hospital, and those are the majority of the cases that we have heard about.
Thanks, Daniel.
Our next question is from Lynn Bonner with the News and Observer.
Hi, Dr. Cohen. Thanks a lot for taking my call. This is Lynn Bonner from the News and Observer. In the past couple of days, we've seen school districts move to online-only instruction, at least for the first few weeks of school. Is the state still comfortable with Plan B, or should you consider a move to Plan C, at least for the first month or so of school? And I'll get another question in while I'm on. Much of the school district decisions to move to Plan C seem to be driven by teachers, many of whom fear return to campuses. Are you confident that school systems will have enough teachers willing to do in-person classes?
Well, Lynn, thanks for that important question, and I'm going to have JB weigh in on that in a second as well. But remember that when we're making any hard decision about schools, and schools has been an incredibly, really challenging decision, you have to weigh both the benefits and the risks. We know there are risks from COVID-19, but we also know the great benefits from in-person instruction. And we know that missing school causes real harm for children. So we were trying to find the right balance, and I think that by choosing a Plan B, we were trying to go with a flexible but balanced approach where we can do some in-person learning and get some of those benefits of being in person, while also acknowledging we need some ability to maintain 6 feet, have less kids in each of the of the school buildings and put in the maximum amount of safety precautions as we go back to in-person learning. We also are encouraging every school district to offer remote learning options for families that might need to do that. And as far as teachers, obviously teachers are, this is incredibly challenging, not just their own, thinking about their own health concerns, but this is a complex to implement all of the different facets of these safety precautions. There's a number of things that we've done. First, the governor announced the other day is that we are sending face coverings to every school district to make sure that they have that. Then we wanted to have the maximum number of safety protocols and protection in place, so that's why we chose the Plan B. But we also want teachers to have the opportunity to raise to their school leaders if there is a challenge for them as being high risk, and then have those school districts work with them on modifications as that becomes necessary. So I'm going to turn it over to JB Buxom from the school board to answer your question further, Lynn. Thanks.
Thanks, Secretary Cohen. I think, Lynn, I think Secretary Cohen said it well, so I'll just make some brief additional remarks. I think what you're seeing across the state are school districts who are working hard to engage their teachers, their parents, their school leaders in figuring out what they can make work in terms of Plan B. I think you're seeing school districts look hard at Plan B and all the requirements in the Strong Schools Plan and the guidance. I think it's really important that parents, teachers, and community members take a look at that guidance and see the strong safety precautions that are in there. I think people should feel comfortable with the kind of safety precautions that are there, and districts, many districts are working to put Plan B in place. Certainly we're seeing districts that are looking at Plan C for a variety of reasons. And I think it's our hope that folks start with the goal that I think everyone shares, which is how do we get students and teachers in optimal learning situations, optimal situations that supports not only their academic learning, but also their social, emotional, physical needs, nutrition needs. And that's what I think school districts with a lot of thoughtfulness, resourcefulness, and creativity are working hard to do right now. Sure. Let me make sure you don't have a follow-up on that.
Our next question is from Victoria Villabasas with Enlace Latino MC.
Hi, everyone, and thank you so much for taking my question. I'm actually curious about the outbreaks or the spread, rather, in congregate living among farm workers, and I'm wondering what the health department's plan is as far as planning for isolating folks into non-congregate housing if they were to get the virus, and who you all are working with on the ground in the rural counties to help that happen.
Well, thank you for bringing up the important topic of our farm workers. We are seeing spread of the virus in our agricultural space, and I think there's a number of things we're doing. First is about prevention. How do we slow the spread? And it's the same things we've been talking about. And we are in the process of sending additional face coverings and disposable masks to our agriculture partners to get to all of our migrant farm workers so that they can have the protection that they need, whether they're out at work or in their congregate living settings or in transportation to or from any of the fields. So first is prevention, making sure that they have the ability to wash their hands, do as much social distancing as possible, and also to be wearing face coverings. The other is about access to testing, and so you see that we have tried to target some of these additional testing sites to where a number of the migrant farm workers are, as well as other agricultural sites. But then I think you bring up the hardest one of all, which is what happens when someone is positive, and then they need to isolate in order to not spread the virus to others. And this is a very, very challenging problem that we've been trying to attack from a number of places. We have been granted what's called a non-congregate waiver from our federal government that allows us to set up some additional housing options, but that's a challenge because folks need to be close to the fields in which they're working and such. So I will not say that we have all the solutions on that front, but is definitely top of mind to think about how do we do to support folks in doing that isolation that they need to do if they are positive. So trying to attack the issue on three fronts, and then I want to turn over to either Dr. Burns or Dr. Martin. Anything else you want to say about farm worker? Okay, we covered it. Thank you.
Our next question is from Rose Hoban at North Carolina Health News.
Hi, Secretary. Thank you for taking my question. So you said that we're going to be seeing some hospitalization data later in the day. Can you elaborate on that? Are we going to be seeing, for example, like which hospitals have how many folks, like how many patients are on the floor versus being in ICUs? What are the kinds of things that we're going to be seeing? And then also with the new mandate from the administration for hospitals to report straight to the federal DHHS, are North Carolina hospitals also going to continue reporting to you?
Rose, thanks for those questions. So first, I would say the data won't be available till tomorrow night, so hang on. And what you're going to see are some additional details around ICU usage and then broken down to regions. It's not going to get down to specific hospital, but it will get to a region. And again, it goes back to us understanding hospitalization capacity at a regional level. So that's the kind of data that you will see tomorrow. As far as this new change in the federal reporting, there's a couple of things that I'll share. One is that the state has been reporting to the federal government on behalf of the hospitals up until now. It's been a great collaborative relationship. We actually have daily working groups that are working on data with hospitals and on all sorts of things as we've gone. This wasn't a very abrupt change. I don't think we got any warning that it was coming. And so we checked in with our hospital partners and decided that it was better and quicker for them to now do the direct reporting to the federal government on their own, and so not come through the state to do that reporting. So, but it does not change the fact that the hospitals will continue to need to submit data to us at the state. Unfortunately, that means that they have to do double the reporting, but we're hoping as we can ingest the new requirements from the federal government that we can go back to streamlining that so we can again report on behalf of the hospitals and just streamline and make it more efficient. But what I'll say is that we went from needing to report 30 data elements to something like 96 data elements overnight. That is not something that happens overnight. So we are working hard on that. And again, I'm disappointed in the way that got rolled out in such an abrupt way. I'm all for data efficiency, but I think we needed a bit more lead time to understand what was needed. And I think we all have questions about when that data is now going to the federal government, what visibility will come back, and how will they be using that data to give all of us the visibility that I know folks want. We will continue to be transparent at the state level, but I think it always helps for us to be able to compare to what's going on in other states and understand where we fit into the national landscape. Thank you.
We have a follow-up from Rose Hoban.
Yes, thank you. Can you give us a hint as to what we're going to see on the hospitalization data? I mean, one of the reason why I ask is that we keep hearing that the new cases are being driven more by younger people. Are they the ones ending up in the hospital? Are younger people ending up in the hospital, or is it still, the older folks who are are a smaller percentage of the total cases? Are they still a larger percent of the hospitalization?
Thanks, Rose. We know there are always more insights to the data than we're going to be able to always give. Though now you're getting into some additional demographics and clinical information related to each case, and so stay tuned for more. But I don't think tomorrow's tranche of data is going to get to that level of detail that you might be asking about. You may be able to get in touch with individual hospitals who are tracking that data, but I don't believe that will be in the release for tomorrow.
And we'll take our final question today from Kate Martin at Carolina Public Press.
Good afternoon, Dr. Cohen. Thank you for taking my question. This is Kate Martin with Carolina Public Press. You said that children are less likely to spread the virus and less likely to get sick. I'm hoping you can quantify that and the differences between the way the hospital acts with children versus adults. I think that teachers are uncertain about the school year because they don't know what the risk is, and maybe that answers to that question will help them. Also, I'm wondering if you plan to send your child back to school in person in any capacity this fall. Thank you.
Yes, Kate. Well, first, it's a good question, and I'd have to go back to the literature to understand the relative change in transmissibility. So you are right in saying children are both less likely to get the infection, they're less likely to get very seriously ill, and then they are less likely to transmit it to others. And I think your question was, help me know how much less and how much less likely are they, and I don't know that, so I'd want to go back to the literature and talk with some of our experts, and we will be happy to follow up on that. But I think it's going to be different in different situations, and again, I continue to caveat that the data that we are getting and the evidence is evolving, so we will continue to look at that science and look at it, but we do know that it is less, and I hear your question about how much less, so we'll get back to you. As far as, yes, I am a Wake County parent. I have two girls who are rising first grader and a rising third grader. And, look, every family has to make a decision that is right for them. But for us right now, as a family, our decision is to have our girls go back to in-person instruction, given what we know now. So we look forward to getting our kids back in the classrooms. But again, I want to respect that every family is going to make their own decision based on a variety of things. So our decision and what's right for us as a family right now is to have our girls go back to in-person instruction, which I think in Wake County means I think they're going back once every 3 weeks in terms of in-person instruction to start. Okay. I think that was the end here. I want to, thank again Dr. Carter Burns, who was with us, and Dr. Viviana Martinez Bianchi. Thank you, J.B. Buxton from the State Board of Education for being here with us. And thank you all for tuning in. Again, today was Data Day, but I want to remind everyone that we have the ability to impact those trends. So I hope you will be doing your 3 Ws, wearing a face covering, waiting 6 feet apart, and washing your hands. Stay well, everyone. Thank you.